Hi, I'm Kelly Greytok. I'm a plastic surgery recovery nurse, and today I'm going to be talking about recovery after eyelid surgery, also known as blepharoplasty. And this is one of those procedures that gets kind of thrown in with other procedures, facelift procedures, upper, lower, things like that. And so a lot of my patients will have this in combination with other things, but I have some tips for you. Please subscribe so you don't miss out on any new videos, and let's jump in. So one of the main complaints after blepharoplasty surgery is your eyes are blurry, which that doesn't seem like a big deal, but if you're trying to do work, if you're trying to check text messages, if you're trying to just do any kind of business on your computer or on your phone, it can be a little problematic. First, let me tell you why. There are a few reasons for the blurriness. Let me tell you about that first. So first off, swelling, of course, and just the nature of the trauma to the eye causes blurriness because, there are more, secretions that happen during the healing process. A lot of times also your surgeon is going to have you adding ointment or drops, medicine, things like that to help your eye heal, and those things can cause blurriness for sure. And so, it's interesting because if you have scoured the internet and seen this procedure, it looks kind of painful. I promise I always tell my patients it's like the least of their worries. It's really just not a big deal. I think the only kind of hassle as far as that recovery is just you have to put ointment or eye drops in, and I will go over that in a minute. But it's not anything that's painful, so please don't worry about that. So one of the first things I do with my patients when I get with them is I change, because this is just something, it's one of those little things that people are like, that made all the difference. And so one of the things you can do is change the font size on your phone, okay? And so it's very similar for iPhone and Android. I have an iPhone, but what you do is you're gonna wanna go to Settings, Accessibility, Display and Text Size, and then you're gonna click Larger Text, and then you can actually pick how large you want it. I would do that before you even go into surgery so it's done, and so then when your mom, your sister, your aunt, your brother, anybody is texting and you want to get an update, give an update, you can at least have some sort of idea of what they're trying to say. Next, of course, you're gonna wanna sleep elevated. For sleeping elevated, I always recommend a wedge pillow, and that's just going to keep the pressure down in your head, which is gonna be better for behind the suture line, just better for getting a great incision, and it's just gonna definitely make you more comfortable because you'll be less swollen. One thing I definitely disagree with, and I don't disagree with a lot of the discharge instructions, but one thing that I am adamant about is do not use peas. And I think a lot of times people recommend peas because your surgeon or your surgeon's staff wants you to think it's no big deal, just get a bag of peas. No, peas are horrible. They might use one time, but they might be good once for one use. But the problem with peas is they're frozen. You put them on, they're lovely that first time, and then you let them sit out or they thaw a little bit, and you go to put them back in the freezer to get them frozen again, and then they're like a glob, and there's edges, and it just is not. This is an investment, and you want to do it right. Don't even mess with peas. I definitely, if you're supposed to be icing your eyes, they have these little round ice packs. There's tons of different brands. They're really inexpensive. You can buy them in packs of 6. And this is something that you're gonna buy, and once you're done with your recovery, you're gonna throw them away because they're gonna get kind of gunky and gross. But this is a super small investment that goes, makes a big difference, goes a long way. It has this material side, and then it has the ice pack side. So just remember, you don't want this side directly on your skin, okay? You're gonna wanna put a barrier, or you're gonna wanna use the material side like this, okay? But the nice thing about these is they come in packs of 6 or 8, is that you can be using them and then be swapping them out. So you always have really cold ones. So you can follow whatever your discharge instructions are as far as once on the hour, 20 minutes on, 20 minutes off, however that works. Also, sometimes your surgeon might recommend cold compresses, which is super, super soothing. That will feel good too. And you would just get a bowl of ice water, and you would just kind of soak your little, I like ovals instead of rounds, just oval, what are they called? Hold on. I think they're just called compresses. They're like makeup removers. They're really, really soft ovals, and you get them in a long cylinder pack, and those are great. The last really important thing I want to tell you, and this is something that back when I was a hospital nurse, I would have to put ointment in people's eyes all the time. And a lot of times you just pull on the upper eyelid and you have to do a ribbon of ointment. First of all, that's not really an easy task, even for someone like me who's done it a lot, just because it's sometimes hard to get that little bit of ointment to kind of let go. And so it gets really tricky when you're trying to do it with somebody and you can't pull on their upper or lower eyelid. So the question becomes, how do I get this ointment in the eye without screwing up my plastic surgeon's work or, you know, ruining your great result? So what I have found that works just as well is try to just focus on getting like a ball, like a pea-sized ball or a little glob of that ointment, and you want to just focus on getting it in the middle of the eye. Okay, so let's say this is usually something you're going to have somebody do with you, but if you're doing it yourself, always have clean hands. I of course wear gloves, but if you're doing it to yourself, clean hands, then put a ball of it on your finger and then literally just kind of push it into the center of your eye. Then blink a little bit and then just chill. Okay, because after a few minutes it will start to get melty and then it will just kind of go under and all around where it needs to be. So that's a great way to avoid this whole, how do I get a ribbon of ointment in my eye? If someone's helping you do it, you just want to make sure, you know, they clean their hands. And then ideally it would be great if they have gloves, and then they can either just squeeze it right from the tube and just, you know, really get it in there nicely, or they can use their finger as well. You just want to, of course, make sure it's super duper clean. And I definitely would always keep everything separate. So if I'm using my finger, this eye for this finger, I would try to use another finger or wash the hand, because in case there's any gunk or any germs in one eye, you don't want to transfer it to the other eye. So what else can I tell you? I think that's it, guys. This is a great procedure. It's one of those procedures that just looks a little crazy, but it's really not a problem. People heal super quick, and when people have a lot of things done, the eyes is one thing they really don't even think about. So definitely, if it's something that your surgeon has recommended or offered to you, I would definitely consider it. It's one of those procedures that really makes a big difference, and it's just has a great result. And so I hope you found that helpful. Please comment if you have any questions, and thanks for watching.